All right, it looks like we are on live. I'm going to give a few seconds for some of our friends on our social media to join us. So once again, today we are on Talk with the Doc, and we have two amazing medical professionals that we're excited to hear from. So those of you who are joining us, thank you for joining on our Wesco Chamber of Commerce page or on our YouTube page. We want to encourage you to leave any comments or thoughts you might have. Today we're going to be talking about what has been the topic of conversation for this year from what we've seen, and that's COVID, and how our medical professionals and our frontline employees are handling all this and taking care of us through this time. And so we're excited to have two medical professionals with us this morning to discuss a little bit more about what we're seeing, how we can handle this, and especially now that we're getting closer into the holiday season and we're going to be seeing some more family gatherings and that kind of thing. So we're excited again to have some medical professionals with us and get their opinions. These two doctors are with Valley Baptist Physicians Network, and we're excited that Valley Baptist, a member of our chamber, has given us the opportunity to be able to speak to these doctors. I know that they're very busy, but they've taken some time to join us and talk to us a little bit about, how they're handling the situation, where they're from, what they've been seeing, and what they've been doing. So thank you all once again, those of you who are joining us live on Facebook and on YouTube as well. All right, so I'm going to go ahead and get started. I just want to quickly introduce myself. Barbara Garza, I'm the president and CEO for the Wesco Chamber. We have been working, around the clock to make sure that we're getting information and support out to our business members and to our community. And we've done several programs that you may have seen through our social media. But as a chamber, our mission is to be able to support our members, provide information and inspiration and support to the community at large. And we've all been dealing with some major changes in our work, but we have been working, like I said, around the clock to make sure that everyone has a good experience and is moving ahead in a positive way. And like I said, right now we're dealing with a mixture of things. We're dealing with the change in seasons. We're dealing with upcoming holiday seasons. We're still dealing with COVID, and we've heard a little bit about a vaccine that's come out. But like I said, we are going to learn a little bit more from our two medical professionals. So I'm going to go ahead and pass it over to our first doctor to introduce themselves and tell us a little bit about yourself. So Dr. Kazim, can you get us started?
Yes, thank you for having me here. I want to thank the Wesco Chamber of Commerce for having me. My name is Dr. Mark Kazim. I'm a board-certified internal medicine doctor and geriatrician. I've been in practice now for over 10 years, and I've come back to the South where I grew up. I've been trained, I did my training at Tulane University, and this is where I did my residency in New Orleans. I also did a fellowship in bariatrics at the University of Hawaii, and I'm very grateful for my time here in the Valley. The people here have been very friendly, and I feel this is a great place for internal medicine. It's been an honor just to work with Valley Baptist. Valley Baptist is very committed to helping the community, providing resources for us to provide the care that's needed during this time. I find that since I've been working here, it's been a great experience, and I'm very grateful again, to be able to do this interview and explain more about our clinic and what we do.
Wonderful. Thank you, Dr. Kazim. All right, Dr. Longway.
Hello, I want to thank everybody for participating in this event. I want to thank the Wesco Chamber of Commerce and the Valley Baptist Physician Network, the Valley Baptist system at large, to give us this opportunity to help our community cope with the ongoing pandemic. Like you said, my name is Dr. Paul Langwe. I'm a native from Cameroon, West Africa, but I've been in the US since 2003. I did my undergraduate at Wayne State University in Detroit. I did part of my medical school training with American University of Antigua, and did my residency in Michigan with ProMedica Monroe Hospital. And I've been practicing since 2016, and I'm a board certified family medicine physician. I also do hospitalist services. At this time, with the Valley Baptist Physician Network Family Care Clinic in Weslaco, we are located behind Walmart, next to the JC Penney. And I am also the attending hospitalist at the Micro Hospital, which just opened right off of the freeway. So this will be an opportunity for us to get to know our community better and let them know that we have essential services and information to help advance the healthcare of our community.
Wonderful. Thank you, Dr. Langwe. Yes, and you're absolutely right. We really want to make sure that we connect you with our community and make sure that our community is aware of the services and just the expertise that we have here in the Valley. I think that is so amazing. What you all bring to the table and bring to our community to be able to provide your knowledge, your experience to support the families here in the Rio Grande Valley. And I thank you once again for taking some time to be with us this morning and talk to us a little bit about what we're seeing right now with COVID. And I'll start there with the COVID pandemic and how we've all been kind of moving through this over the months. We went from being in quarantine, having very strict restrictions on what we could and couldn't do at the onset of this, and we're moving into a point where they're loosening some of these restrictions. We have seen a little bit more gatherings and events, and at one point we saw the cases go down. But I'd like your feedback or your thoughts in regards to where we are right now with cases and how that is affecting our community. So whoever would like to take that and just give us some of your thoughts in regards to the current pandemic.
Okay, well, I'll kind of talk first here about what's been going on. So obviously this has been a huge crisis that has occurred here with the pandemic. I think we've, our clinic has really remained open during these difficult times since February, and we are offering telemedicine as well as in-person visits here at the clinic. We do have the capability of testing for COVID-19 here at this clinic, and we have 3 providers here, 2 family practice, 1 internal medicine, as well as neurology services. So we work closely with our micro hospital, which is located right across the street, or actually right across the highway from where we are located. And so we coordinate our efforts with them, in terms of helping patients and providing the best care that we can for them.
Yeah, I mean, and you're right. Both of your clinics and service areas are right off the expressway. So I mean, it's something that people can see, can access quickly. And I know that as far as the testing, is that something that has evolved from what you've seen from the beginning of the pandemic to this point? I think that there's different kinds of tests. Dr. Langwe, maybe you can kind of also chime in here and give us a little bit of information as far as like the different kinds of tests that are available for COVID and what you all have available.
Yes, thank you very much for that question. The testing has evolved, definitely. Like we all know, this is a new virus, very unfamiliar to us. So like with every disease, we have to find a way to identify it so we can properly treat the sick and also, prevent it from spreading within the community. And one of the ways we can spread it is making sure we have quick tests, especially a disease like COVID-19, which spreads so easily and very quietly without us knowing, and it just creeps on us very silently. So with respect to that, there have been many advancements when it comes to testing. We're trying to come up with very quick, rapid testing that we can be able to identify people quickly. The thing is, some of those tests, their specificity is not the best, but the most essential thing at that point is to do the screening. And if we know we can get you tested quickly and get the results back quickly, we can easily apply the intervention quickly, which is the most essential part. So we have the PCR test. We have also the antigen test. The antigen test is the quick one. It's kind of like the flu test that we do, where you go to the doctor's office, they swab your nose, and within no time, we'll find out if you have it or not. It doesn't mean you don't have it. It just means the less likelihood of you having it. So if you come to a physician's office, we're suspecting that you may have COVID, and we do the test and you test positive, it confirms our suspicion. But if we think you don't have it, your likelihood of having it is low, and then we do the quick test and you come back negative, then it proves that maybe you really don't have it. So at that point, we are reasonably comfortable letting you back into the community, knowing that you won't spread it. But at the same time, you still have to maintain the preventative measures, which are the most important tool that we have available to us at this time. The PCR test takes a little bit longer. It can take up to a couple of days, depending on your location. In our area, that's about what it takes at this time. So it used to be longer when we were at a very peak in the summer. It used to take longer, but we have implemented some measures that kind of help with everything, and the community has been very active in helping us do that. So right now we do have the rapid test, which is the one that is readily available and give us the results quicker. But there's also a PCR test, which we go to that level if we are highly suspicious that you have the disease, but the antigen test comes back negative. There are still other ones that are still in development, like the saliva test and all those stuff, but those are still in the making. We're not there yet.
Yeah, exactly. And thank you for that description of the different tests. So, when we talk about COVID and we think about the different recommendations that we've seen over these past few months, what are some general suggestions and feedback that you would give our community at large about staying safe and practicing these, hygienic practices to be able to stay safe during this time? Dr. Kazim, do you have any suggestions for the general community as far as what they should be doing right now to stay safe?
Yes.
And stay away from COVID?
Okay, thank you for letting me answer that. So basically, the most important thing is to wear your mask. I think that cannot be understated in any shape or form. It is very important to wear a mask. The mask is the best way to help prevent spread of the virus. Of course, you do want to maintain that 6 feet of distance from other people, because not only are you going to be protecting yourself, but you're going to be protecting other people, and especially vulnerable people like the elderly and those who are immunocompromised. So it's very important to do those two things. Then, of course, wash your hands. You want to wash your hands often, and just maintain that distance from other people. I think that's very important, to help mitigate the spread of this disease. There's a lot, we can do with just those measures alone that can help prevent not only the spread, but of course, contracting the virus itself. And I think these mitigation measures cannot be understated in any way. Of course, using common sense is important too. If you're going to be with other people in a large group, you may want to consider, maintaining some distance, wearing a mask, because you don't know who's going to be sick with the virus or not. There can be asymptomatic people, and that's how easily this virus is spread. And it's more important, especially with those who are elderly, like in congregate settings like nursing homes and assisted living facilities, where would be a greater risk for them to, contract the virus. So I think those three things are really, key to helping prevent the spread of the virus. And they're very simple things to do.
Yeah, you're absolutely right. And I think that, I love that you brought up the point of wear your mask. It's really one of the simplest things you can do, but it's for your safety and for those around you. And we've heard from the beginning that even though it may not fully protect you 100%, you're also protecting, it's also to protect those around you. And be responsible in that way. And we really want to keep pushing that message and drive that home with all of our communities that we really need you to wear your mask when you go out in public. And I think this might probably be a pet peeve for you guys, but how about how we wear the mask? And does that matter if I wear my mask under my nose? Is that helping me? What are your thoughts there? Dr. Longweir, Kazim, whoever would like to take that one.
Okay. Well, the whole point of wearing the mask is to make sure we don't spread our droplets to other people. You can spread the droplets through your mouth when you talk and through your nose. So when you wear the mask, you want to make sure you cover both your mouth and your nose. It's very essential. because it defeats the purpose if you wear it under your mouth, under your chin, and then you leave your nose open. That's where some of the droplets can still come out and spread out to other people. Take, for instance, if you go do a surgery and the surgeon come in, open you up without any mask. I don't think you'll be comfortable with that. That's the whole point of the mask. That's how it works. Even though you might walk around thinking you're not sick, the virus might still be in you without your knowledge. And it is true that means that we spread it to others unknowingly, even to our loved ones. We don't know, and then finding out later that, oh, our loved one may have been sick, or we may have lost them because of our inaction. So I'm really encouraging everybody to wear the mask properly, which is to cover your mouth and your nose. I know it's uncomfortable, even for us physicians. We don't feel comfortable wearing it, but it is our duty to protect ourselves and other people. So we think it's appropriate to wear it. We strongly encourage everybody to do it. Right now, at this current time, that is the best tool we have. We are looking for other measures to increase our options, but at this time, the best tool we have is the mask, is to wash our hands, is to keep the distance, is to avoid gathering as much as we can. Yes, the vaccines, when they come through, they will help us, but until then, we have to be responsible and try to give us an opportunity to make it to that time so we can be able to use the vaccines. If we don't implement these measures, some of us might not be able to make it to that time. So that's why we strongly encourage that every one of us wear the mask, wash our hands, keep the distance, avoid gathering as much as possible. And I think if we do that, we'll be able to overcome this pandemic.
Yes, thank you. Thank you again for explaining that and ensuring people understand why it's so important to wear your mask. You know, I sometimes will go out to the store and see that people are not wearing the mask correctly, and then I think at that point, why wear it? You're not going to wear it the right way. Make sure that you're wearing it correctly because there's a purpose behind it. So thank you for explaining that. So right now we're seeing a spike in cases, and this is not just in the Valley, but across the country. We're seeing that there's a spike in cases. Now, this could have to do with the fact that there's going to be more gathering. There's families that are coming, together during the holiday season. Dr. Kazim, can you give me a little bit of your thoughts as far as this spike that we're seeing, maybe why we're seeing that, and what are some recommendations you have for our community as these cases might continue to rise over the coming weeks?
Okay, thank you again for allowing me to answer that question. So basically, yes, this all goes back to, what we talked about earlier, wearing your mask, keeping that 6 feet of distance. A lot of people have fatigue, from the COVID-19 pandemic, which really, started many months ago at the beginning of the year. And it is easy to fall back into the old ways and, not take this as seriously as you should. And we should all be taking this seriously, especially, like I said, for elderly patients and those who are more vulnerable to the disease. So, I think we're seeing this spike. This is not something that we didn't anticipate. It's been anticipated by the CDC and I guess the World Health Organization. We're seeing the spike not only here, but, around the world. And, I think still those practices that we talked about, washing your hands, maintaining that 6 feet of distance, wearing your mask are still very important because they're going to be the best mitigation or prevention measures we have. I think the spike, it's also going to coincide with the time of, obviously the flu. So it's very important that people do get their influenza vaccine. It's going to make a huge difference in terms of, helping to prevent, dual diagnosis, God forbid, of both flu and COVID-19. So I think, if people can get the flu vaccine, it would be definitely very, very important that they do, especially elderly people, to get the high dose flu vaccine. The spike in cases, yes, we're hopefully getting better with our testing. More people are coming forward to do the testing, and I think that that's going to attribute to some degree the rise in number. But of course, it's colder weather, usually for most of for large parts of the country, and of course, people are more enclosed together. And then, of course, we have Thanksgiving and Christmas coming up. So people just have to stay vigilant. I think that's the most important thing, and it's difficult, but I think if, realizing how serious this is, if we can all come together, I think that'll be very important.
Exactly. And you mentioned the flu vaccine. So I kind of want to jump into flu season, because aside from everything that you all are dealing with on the front lines and with your patients, you have the flu season that's coming along, or that's here. And aside from dealing with the current pandemic and health crisis and everything else going on. So I don't know if you can kind of help me clarify this for people, but we often hear, when it comes to the flu vaccine, I don't want to get the flu vaccine because it makes me sick, and I don't want to be sick. And so can you kind of help clarify that and what that means and why it's important to get that flu shot? I mean, you mentioned for the elderly to look at getting the higher dose. So how could we explain that to the community as far as why it's important to get your flu shot? Dr. Kazim, you want to touch on that before we?
Yes, of course. So basically, it is important to get the flu vaccine, because a lot of the symptoms of COVID-19 and the flu overlap. So obviously, it makes it more difficult to diagnose, even though we have these tests. We have the rapid flu test. We also have the various COVID-19 tests that we discussed earlier. But the flu vaccine is very important because, like I said, you don't want to be dealing with both flu and COVID-19, in the worst case scenario, if you contracted both of those diseases. I think the other aspect of it is too, a lot of people may have, some trepidation or fear about the flu vaccine. And I think mainly that comes into play because, maybe they've had a bad experience with the flu vaccine before or a reaction to it. But that doesn't necessarily mean they've contracted the flu. The flu vaccine, they look at the previous years. They try to put together, a flu vaccine which they think will be most able to combat the flu season for the upcoming year. And there may be some mild reactions. Some people may develop muscle aches, fever, muscle soreness, redness around the injection site. Hopefully, this year more people will be more willing to do that, because I think it does make a difference and it helps. We actually have been able to reduce mortality of the flu in previous years through the flu vaccine. So I think it would help for us to just press that message across. Get your flu vaccine. This year is different than other years because we have COVID, and I think it's really critical that people understand that. Now, the high dose flu vaccine in the elderly, some people may be more predisposed to side effects from the flu vaccine. So from the high dose, so sometimes the regular flu vaccine is okay if you can't tolerate the high dose flu vaccine. But that's generally given to the patients who are over 65 years old. So essentially, I would advocate it. If you haven't gotten the flu vaccine before, I would recommend that you really consider getting it this year. If you've had a bad reaction to the flu vaccine before, make sure it's not an allergy to the flu vaccine, and really consider thinking about that strongly by getting it, because it could make a huge difference, especially with someone who's got maybe diabetes, hypertension, is obese. They're going to be more at higher risk. And like I said, you don't want to be dealing with both the flu and with COVID-19. There's good evidence that it will help, reduce the symptoms of the flu and, can help prevent the flu altogether.
Yeah, exactly. Perfect. And I hope people are getting that message and getting their vaccines. Dr. Alangwe, is this something that patients could go to your clinic or to the hospital for to get that vaccine with you guys?
Yes, we encourage patients to come to our clinic. We do have them. Most doctors' offices do have the flu vaccines. Also, most pharmacies do offer flu vaccines as well. So typically the hospital offers it, but they don't like walk-in. They usually reserve it for patients that are there. So I will encourage the community to go to doctors' offices and pharmacies for their vaccines. Some healthcare centers do have it. I'm not sure here locally where those places are located, but I know for sure pharmacies and doctors' offices do have it. Our clinic, we do have it. We do offer the flu vaccine, yes. And just to add to what Dr. Kasim says, I strongly encourage the flu vaccine. Yes, just like with everything, once you put something new in your system, your body will try to adjust to it. So some of the reactions that we get, they are usually like mild body aches and stuff. They usually go away within a day or two, but the benefit that you get from taking the flu vaccine significantly outweighs whatever mild body aches you might feel. That doesn't mean you have the flu. The flu vaccine doesn't give you the flu. It doesn't cause the other stuff that we see in the social media, like the autism. There's no scientific evidence for that. So I strongly encourage everyone to take the vaccine, and it will help prevent you from getting the flu. And maybe, God forbid, you get exposed to COVID. You don't want to have two different diseases hitting you at the same time, especially your lungs. That would cause significantly more damage than otherwise would have been if it's just one. We pray that you don't get any of them. And one of the ways to prevent you from getting them is to take the vaccines. So, and also to try to implement some healthcare measures, preventative measures like the mask, like the hand washing, like the distancing, like avoiding the gatherings. Those things will help us. It's just like, when you drive, you wear your seatbelt. Not that you're going to get an accident, but it's just to prevent you and give you a better chance of surviving should you get into one. It doesn't mean you will get into one. It's just to increase your chances of survival. The same thing can be applied to the vaccine. So that's why we strongly encourage it.
Exactly. And again, as far as flu shots, I'm curious, have you all heard or seen maybe as far as a shortage or anything like that in regards to vaccines, given that maybe there's more concern with COVID happening and people wanting to get these vaccines? Have you all seen anything like that or anything like that in the Valley at all?
I haven't heard anything like that. I haven't seen that in our practice. If anything, talking to my friends, and some of whom are pharmacists, they are slammed. Everybody seems to be more proactive this time around to get the vaccine, and that's a really good thing. I strongly encourage that. In terms of shortages, I haven't heard of any.
Yeah.
We sure don't have it in this office. So if anybody is needing one, I encourage them to stop by.
Good. So just to kind of pick your brains about it, because I know I'm sure you all have been listening to the news, and we heard about this vaccine for COVID. What are your thoughts on how quickly this has been developed? And I know that we hear vaccine and people think immediately, oh, well, where do I go get it? And it's not available yet. And that's what people need to understand, is it's still something in development. But what are your thoughts as far as behind the science of this, the fact that they're able to create something at 90% efficiency at this point? Just kind of curious what y'all's thoughts are. Dr. Kazim, you want to take that?
Thank you for allowing me to chime in. Well, I'm cautiously optimistic about the vaccine. There's still a lot we don't know and a lot of information that still has to come through, but I'm cautiously optimistic that we will have a working vaccine. And as we know, there are multiple companies working on a vaccine, some utilizing new technology that we haven't seen before in a vaccine. So again, I'm still waiting for the data. I mean, this is preliminary data so far, but it is all very, very encouraging. And, my hope would be that, we have an effective vaccine and one that can be readily deployed, and that, that the safety and the data is behind it, so that we can, effectively, treat, help prevent, COVID-19. Now, the data that we have so far is just very preliminary. That 90% number comes from, I would say a small number of patients. So it still probably isn't enough to, really, hang my hat on it yet, but it is very encouraging. And I know Dr. Alongwe will probably want to expound on this more, so I'll let him say something as well.
Well, just like Dr. Kasim said, we have encouraging signs about the vaccine. I know the speed is kind of fast compared to the typical timeline for a vaccine. Part of the reason is we are in a pandemic and we're trying to get solutions as much as possible. Part of the reason is also because, unlike in the past where most of these companies have to take the financial risks themselves, this time around the government is also kind of assisting significantly to advance the process. So those are some of the reasons why things are moving the way they are. And with the help of technology, people are getting more creative in ways that can help advance healthcare. The technology behind the current vaccine is kind of new, but that doesn't mean it's not a good technology. So they have preliminary data that seems to be encouraging, but it's not at this time sufficient, in my own opinion. But they're still working on it. They plan to put out more data, especially when it comes to the safety measures, because we're going to be giving a huge sector of the population. We got to make sure the vaccine is safe. So hopefully we'll be able to get more information soon when it comes to the safety aspect as well as the efficacy. I know in terms of transportation, it's going to be a little bit challenging for some of the vaccines, not all, especially the current one. But that's where the government comes in to help with creating the resources to transport it. And then hopefully we'll be able to get enough information at that time to be sufficiently comfortable to give it to our people.
Wonderful. And yes, we'll be paying attention to the news and trying to see what comes up next. But I think that it's great to hear that there's this kind of progress at this point, and that you all get to stay connected with this and keep informed on what could happen and how to deal with this if a vaccine is to be able to come available. So when we talk about, jumping back into COVID, we talked a little bit about dealing with COVID and, now dealing with the flu season. We're seeing that different cities, different counties are have different restrictions within each area, and so our restrictions have been different over the past few months, depending on the number of cases. But we are seeing a spike in cases here in the Valley again, and so I kind of just want to get a message from you that you'd like to share with the community as far as how to stay safe, and any recommendations, whether it be going in for a checkup, if they're not feeling good, or what to kind of look for. Because sometimes, you mentioned the asymptomatic, you may not feel anything. And in some cases you may feel, you're not feeling too good. If you're not feeling too good, should you still go out, or what kind of recommendations would you have? So just kind of a take home message to our audience as far as, where we are right now with the current pandemic. So I'll give on to you, Dr. Kazim.
Thank you. So basically, you're going to want to look for a few symptoms. I mean, there's a lot of symptoms really with COVID-19. We're learning, day by day. There's some new symptom. The symptoms I most commonly ask for, though, and we have this screening protocol at our clinic. We screen patients at the door. Essentially, they have to call before they enter. And of course, we have telemedicine capability here at our clinic, in addition to having appropriate PPE to be able to see patients in the clinic as well. And as we mentioned earlier, appropriate ways to test for COVID-19 as well as influenza here. So I think the most important symptoms we look for, are fever, cough, sore throat, any shortness of breath. Other symptoms include body aches. We've all heard of loss or taste or smell, basically malaise or just fatigue, which is just feeling tired. And some of those symptoms do, of course, overlap with the flu, which makes it difficult to diagnose amongst the many other types of respiratory ailments that can occur at this time of year, especially as we head into winter. So, of course, that makes it a little bit difficult to diagnose, but I think there are a few symptoms that are, particularly, characteristic, with COVID-19, particularly the fever, the sore throat, and of course, a cough, a dry cough, not usually very productive. So if you have any of these symptoms, it's very important to, seek medical care. And that can be, through telemedicine, which we offer that capability either via the phone or televideo. We actually, some of the patients I've seen here, as initial consult has been through telemedicine or through televideo. We have that capability here, and we've actually geared our clinic towards that in some ways. So you really want to look for those symptoms. Of course, God forbid if you develop any shortness of breath, worsening fevers, body aches, you want to make an appointment in person, and of course call ahead. And when I say in person, I mean like an emergency room. Especially if you develop any shortness of breath and you have diabetes, obesity, hypertension. Shortness of breath usually portends a worsening symptom of the disease. But for the most part, I think between our hospital system here and our clinic, I think we're pretty well versed in terms of helping to diagnose patients, providing a resource for care, and being there for them. Our clinic takes appropriate measures. We're very vigilant about checking temperatures here in our clinic, all staff, including, obviously the physicians, our office manager, and, keeping everyone safe. And I think that's the main goal of this, is to keep everyone safe here.
Yeah, and I think that, it's a great point that you mentioned about the telemedicine. I really think that people should really take advantage of that resource, is to be able to meet with a medical professional through the phone or through a video conference. I know I have taken advantage of that opportunity to utilize the telemedicine. And I think that it's a great, it's great technology to be able to do that and meet with a professional. So can you talk to us about how that works? Maybe Dr. Longo, if you want to maybe share, if somebody is looking to do a telemedicine appointment, what would they have to do with your clinic or with your clinic to be able to do a telemedicine appointment?
So we have our contact listed on the screen. Just call the office and you'll be able to talk to one of our staff members up front, and then they will be able to go through some screening process with you and schedule you for the telemedicine based on the technology that you have available. We have some patients who have some difficulty with the video aspect of telemedicine, so they elected for the telephone, which is fine. Ideally, we'll prefer the video because we can see you in person and make at least some observation during the process. So that is the preferred option. But if you don't have that option, telephone too is fine. We can still talk to you over the phone. So call the office number, which is 956-246-4410, and then someone will be able to set you up for the telemedicine encounter. We typically use Zoom here for the video aspect, and the telephone one will just be a normal telephone call, and we do it that way. Also, to add on more on what Dr. Kasim was saying in terms of information for our community to prevent the spread, we also have to understand that the history is very essential. So whoever we are around, we should keep that in mind. So if, let's say, you hang out with somebody, you're not feeling well the next day, you might want to check with the person, hey, are you feeling the same way? Because some of us get tested positive for COVID, and we know we have COVID, but we don't release that information. And so we find out, like I had an incident in the hospital where the patient came, they did have it, but they were around somebody who had it, but they didn't know. So that is also essential. And like he said, we have to be mindful of our family members. If we know we have people around us who are high risk, we have to make sure it's our duty to help protect them as well and try to do the things that we're supposed to do. Mask up, wash our hands, keep our distance. If we feel some fatigue that is unusual, we have to make sure we check in with our physician, or it could be via telemedicine or via telephone or in person. But you have to go through the screening before you can be allowed into the facility. So anything that is unusual from your baseline, people know how they typically feel. So it's like, oh, I'm tired. Yes, I'm always tired, but this tiredness is a little bit different from my typical tiredness. They may want to check because it could be that.
Yes, exactly. Great points. Thank you all for sharing that. And Dr. Longo, you mentioned the phone number. That's actually up on the screen. So for those of you watching, if you are needing to schedule an appointment, the phone number is up on your screen there, as well as the address, so that you can reach these awesome physicians here in Weslaco. I'm going to brag about that because you guys are right here in Weslaco, Texas, everybody. So we have some amazing medical professionals. The expertise that's here in this area, is phenomenal. And we're just so excited to have, people like you here with us to be able to take care of us and provide this kind of information to the community at large, because, it's difficult. Sometimes people get scared and are intimidated with the whole process of, seeking the information, making that appointment, because sometimes they don't want to know what they might have. But it's just so important to speak to a doctor and have an opportunity to have these conversations. And I really want to emphasize that to the community. And if, a potential patient, is that meet your doctors, get to know them, let them know how you're feeling. they want to help you. And as you can see here from Dr. Longway, Dr. Kazim, they're full of amazing information that they want to help you. And I think that that's something really important for patients to understand, is that when you have a visit, the point is to be able to have a conversation with your doctor about how you're feeling so that you can better your health. And I did also want to mention about the telemedicine. If you are looking to make an appointment, you can reach them at that phone number. And there's 4 doctors in this particular area that we've been sharing your information, and I'll put that information up in the comments as well. But we also have Dr. Garza, who I know that we've met before. He's been at different events with us, Dr. Garza, and also Dr. Torres, who are part of you all's team. And so again, for those of you who are looking for a physician or want to stop by, you have some great options here in Weslaco. And again, like I said, I'll brag about that because we are the Weslaco Chamber, and we're just so proud to have medical professionals here in this area with the expertise that you all have. So before we close up, I just kind of want to say thank you to those who have joined us on social media. We appreciate your time and listening in, and all the likes and the hearts that you all have gotten in this session, because we know people realize how important it is to hear this information and to meet with our medical professionals. But before we close up, I kind of just wanted to kind of go back and see if you all could, again, give us information on where you can, where patients could find you if they're wanting to make an appointment. So Dr. Kazim, can you give us information on the clinic, on how anybody could get a hold of you, where you are, and any information you want to share with us?
Mm-hmm. Yes, of course. Thank you. Thank you. Yeah, so we're conveniently located in a shopping complex next to JCPenney. So we're right there. We have neurology, again, in primary care, both internal medicine and family practice here. We're located at 675 East Expressway 83. And again, our number is 956-246-4410. You can call us. We also have an answering service that is able to help in case it's after hours, and we can promptly get you scheduled in for appointments. We do our best to try to get patients in that day, and we do have availability to accommodate patients. I think that's the most important thing. We are here for you, and we do have openings. So anytime you feel a need to make an appointment and want to get further care, we're here for you.
Awesome. And Dr. Longway, can you also mention the hospital? I know you mentioned that's another area that you assist with. So could you talk to us a little bit about Valley Baptist Micro Hospital if somebody's looking for it or looking for information?
Yes, Dr. Kazim and I do run at the Micro Hospital here in Weslaco. Valley Baptist just opened a Micro Hospital here in Weslaco. It's off of the freeway, right across from our clinic on the other side of the freeway. And we do admit patients there. Not critical. The critical ones we do send to Harlingen. So most of our patients will be able to have continuity of care. So like, let's say a patient visits us in the office and we think they may need some more urgent care, so we can send them directly to the hospital, and we're gonna still be the same physician managing their care there. So the continuity flows smoothly. Even they eventually need to go to Harlingen, we are part of the Harlingen team, so we can still follow their care. So they pretty much have a smooth care. It's not like there will be lapse in care where we'll be like, okay, what happened here, what happened there? We're gonna be able to access everything. So that's another tool that we have for our patients here at this clinic.
Awesome. Okay, and I think in the comments we have there the address in case anybody would like more information. So I believe we're about ready to close up. I do want to say thank you to those who have joined us on social media, and most importantly, thank you so much, doctors, for being with us today, Dr. Kazim, Dr. Longway, for your time. I know that you guys are super busy right now with everything going on, and then staying informed on top of all of that of these current situations. So I thank you so much for your time. Before we close, is there anything you'd like to share with the community before we close up here today?
Well, I would like to thank the community for welcoming us. I've been in this area with my family for a little bit over a year. It's been an awesome experience, and the people in this community are great. I get to meet great people every day, and they keep confirming the reason why my family moved down here. Every day it looks better. They're treating us very well, and we appreciate that. I also want to let them know that we are available. This clinic is available for the community. The specific reason why it's located in the plaza is to help increase access. A lot of people come around this area to go to JCPenney, to Walmart, to Academy, to Matraswell, and the restaurants around. If anything happens, we are right there. If they need our service, we'll be right there. So I encourage the community to take advantage of the resources that Valley Baptist has been able to provide. So
Awesome. Thank you, Dr. Longway. Dr. Kazim?
I agree 100%. I am very grateful, obviously, to be able to talk about our clinic here, and very grateful to the people of Weslaco. I really enjoyed moving down here. It's been a great experience, and I love the area. So the patient population has been great, and overall, I've been very happy and pleased to be here. And I hope to be, a continued resource for everyone here. And like Dr. Longway said, stop by. Come to our clinic, get to know us. We're here for you.
Wonderful. Thank you so much, doctors. And we see the love coming in from those who have joined us on social media. Thank you so much. We see the thank yous coming in to you all for your time and expertise. So thank you again for being able to come on here and talk to us. We appreciate you. The information to contact Valley Baptist Physician Network and Micro Hospital is on the screen there. And we encourage you to connect, make an appointment if you need to do so. We have amazing medical professionals here, and we're very grateful to both of you for your time for taking care of our community. So thank you so much. And we want to wish everybody a great day, and stay informed, stay safe, wear your mask, and happy holidays as we get closer to those. And just want to remind you to stay safe during this time. Thank you, everybody. Thank you, doctors. Have a wonderful day. Thank you.
thank you. Have a good day.